Hi, my name is Laura Silverstein and I'm the Director of Patient Services at TrueCare. I'm just going to go through the proper process in order to put on personal protective equipment. The first thing we're going to do is put on a gown. When you put on the gown, just make sure that you're tying it behind you. There's usually a tie at the top and in the middle. Make sure that you tie it securely. The next thing that we're going to do is put on the mask. Some of the masks have elastic and some of them have a tie. You're going to make sure also that the top part of the mask is facing your nose. That's usually the part with the wire inside. And then you're just going to press it to your nose to make sure that it has a tight fit.
Okay, and then we're going to put on the gloves, and we're just going to make sure that the cuff of the gown is inside the glove so that the glove is covering the cuff of your gown.
We're going to go through the process of properly removing personal protective equipment. The first thing that you would remove is the gloves. I'm going to grasp the glove from the outside, and then with my ungloved hand, I'm going to remove it from the inside of the glove, being careful not to touch the glove with my ungloved hand. The next thing we're going to do is take off the gown. Not going to touch the outside of the gown. I'm just going to touch the ties and untie them. You can rip them. And then I'm going to pull it from the inside and roll it up into itself, being very careful only to touch the inside of the gown. The last thing we're going to do is take off the mask. I'm going to pull it off from behind the earpieces, whether it's a tie or an elastic. Also being careful not to touch the outside of the mask.